Hello, I'm Dr. Ian Strawford. I'm a cosmetic and wellness doctor, and I'm the medical director at Skin Excellence Clinics. I'd like to tell you a little bit more about our precision health and wellness services that we now offer at Skin Excellence Clinics, one of the first clinics in the southwest of England to offer such services, I have to say.
Tell us about why you're offering health and wellbeing services at Skin Excellence Clinics.
I was a GP in the NHS for 30 years, and I've been a cosmetic doctor for over 15 years alongside that. And I've been increasingly interested, certainly over the last decade, in health and well-being from a personal perspective and my family's perspective, how we can live longer and healthier. And certainly from a cosmetic doctor's perspective, I've always been looking at how the individual can slow down the aging process, how they can respond better to treatments, how we can improve the cellular functioning in their bodies so that they respond in a more appropriate way to these treatments that we do to improve their appearance and reverse the signs of aging. So to me, the two go hand in hand, because if we can slow down the aging process, if we can improve our health and well-being, then we're going to look better and feel better, but also our treatments that we offer are going to be much more effective. So it's almost like working from the inside out, whereas in the past, in cosmetic medicine, we've been perhaps just looking at the outside and trying to work backwards from the outside, forgetting what's going on in the inside. And that just doesn't make sense to me. And I think the bigger picture is not just about how we look, but it's how we feel, and that comes down to how healthy we are.
What are epigenetics, and how can this help us live healthier and longer?
Epigenetics is the exciting development, certainly for me, and what we're now offering through Skin Excellence Clinics. So we've conventionally been able to look at what's happening in our bodies through blood testing, through serum testing, and the like. And from that, we're looking at maybe deficiencies or even diagnosing disease processes or measuring inflammation, etc. So that's almost looking after the horse has bolted. We've not been able to look at what's happening to the processes within the body that enable health within our body. And all of our health, all of our functioning of our body is dictated by our genetics, so the genetics that we're born with. But we know that our genes express themselves, that they have to express themselves through life to enable our whole body to function, to grow, to replicate, to reproduce. But that effect of those genes is affected by the cellular environment that the genes are working in. And we know lots of things can affect that cellular environment. It could be stress, it could be toxins, it could be inflammation, whole heap of things. And we know that what happens to our genes is we can start to get gene defects occurring through the aging process and through that cellular environment that our cells are living in. And these are called SNPs, which stand for single nucleotide polymorphisms. Imagine that our DNA is just a coding sequence that's telling our cells, telling every process in our body how to work and how to function. And if that code slightly changes, then the message can change. And that's what happens with these polymorphisms. So if we can detect these polymorphisms through genetic testing, then we can have an understanding of which systems are not working properly and which systems can work more effectively, and how we can use perhaps nutritional or even medical therapies more precisely to affect those gene problems. So that is called precision medicine. And it means that we can come out with a bespoke nutritional program or a bespoke hormonal program or a bespoke medical treatment program specific to you, your body, your DNA, and your cellular environment. And that, to me, is really looking really beneath the bonnet of our car and diagnosing what's actually happening in the engine in our body before disease and pathology gets going. And that's how we can, I think, alter and improve our health span, which is the time we're alive without any medical problems, living a happy, fulfilling life, with a functioning body, and at the same time improving our lifespan, which is the years we're on this planet. So I think for me, it's an exciting development, and epigenetics is a tool now that we have to really look closely at an individual level and advise and prescribe based on the results of that testing.
What epigenetic testing do you currently offer, and what's in the pipeline?
So we are currently offering a range of epigenetic testing, and looking at specific genes in certain pathways to do with that. So one of the most popular ones we're using at the moment is called the Tricher test. And this is looking at the gene malformations that might be affecting our hair in terms of hair loss, male pattern baldness, female hair loss, and specifically what nutritional therapies are needed when it comes to maintaining healthy hair and preventing hair loss or supporting hair growth, and also specific medications that can be used to block certain effects of hormones on hair, such as the classic one is minoxidil. We know that minoxidil does block the prostaglandin pathway and can help with male pattern and female pattern hormonal loss. It's usually applied topically, but in 40-50% of people, it doesn't work. Why? Well, we now know from epigenetic testing, from the Tricher test, we can see whether it is going to work for you or not. And if it doesn't work, what other medications will work on that pathway effectively? So we can bespoke prescribe hair loss treatments. We can bespoke advise nutritional support for hair loss and to help with hair loss. So that's one example. That's called the Tricher test. Another example is the Nutri test, which is looking more widely at nutrition on a bodily level, and which genetic malformations are happening, meaning that we can't process certain nutrients effectively and get the most out of our food, and which supplements we may need to have and why we might need to have those, and where in that processing of nutrients are the supplements needed. Because obviously a classic example is whether we methylate, and methylation is very important because this is how we convert a lot of things in our body, both nutritional and also how we detoxify things in the body. So if we're a poor methylator, and we can detect that through this genetic testing, then there are very specific supplements that are advised to help with that methylation process. So those are two examples that we're widely using. We're also starting to use epigenetic testing for hormone replacement therapy, both men and women. We're looking at a treatment, epigenetic testing for acne, and looking at bespoke treatments that are going to work, and nutritional support for acne. And there's more to come. We're looking at biological aging, so we can actually start to assess cellular biological age versus our chronological age. And these are all extremely sophisticated diagnostic procedures, looking at internally as where we're at within our body and what things we can do, and how, therefore, what we can advise people to do, and maybe even prescribe things for people. Precision medicine. This is precision health and precision medicine.
I've heard biohacking is in vogue. What does this mean?
It's a great term, biohacking, isn't it? Now, this is what's led on from epigenetic testing and these advanced testing methods we have. So biohacking is actually a term used whereby we can try to reverse disease processes. We can reverse processes, aging-related processes with the body, and perhaps reverse our biological age. And that's through interventions that could be lifestyle interventions, it could be nutritional interventions, supplements, it could even be medication possibly, reversing the biological age of our cells. And that's given this term biohacking, which is becoming quite popular in some circles now.